today is going to revolve around what we call forecasting in healthcare. Of course, in simple terms, forecasting is about looking ahead to be able to understand what things that we need to do in our healthcare space so that we can become better. Yesterday, there was a lot of emphasis in matters to do with quality. So we will be asking ourselves, or we will be explaining why forecasting is very crucial for efficient and effective healthcare operations. We're also going to describe how accurate forecasting can impact the financial performance. We are also going to be able to compare historical data that is based on forecasting. So sometimes when we are forecasting, we also look back and see where we are coming from. We will be mentioning that as we continue. And also, by the end of the discussion, we will also learn how to analyze issues around patient demands, issues around disease trends, issues around costs, various costs within healthcare facilities and healthcare space, issues around staffing, that is in terms of the number of employees that we may need in a healthcare facility, and other relevant variables. So forecasting is wide. We look at very many aspects and variables to be able to try and get it right in a particular area. So slide number 2, it's now our introduction stage or introduction slide, and where we are emphasizing on the need for healthcare managers. Remember, we mentioned these guys in our previous lecture where we say these are the CEOs and the COOs of healthcare facilities. And we are saying these people need to make constantly or constant decisions about how they intend to deliver their service. And they are doing it. You have heard us say very many times that the future is uncertain. So some of the decisions that we intend to take around what we have just mentioned, around staffing, patient demand for a particular service, we cannot ideally tell how it's going to be tomorrow. So it is important to be able to look into the future as we make these decisions. So now, because the future is very uncertain and we have limited knowledge about the future, and now the aspect of forecasting comes in. It is not going to help the healthcare managers or everybody to be able to anticipate future demand and plan accordingly on how they are able to handle any emerging issues around whatever issue of discussion. And then also we say that accurate forecasts are crucial for short-term, medium-term, and long-term planning across the healthcare service production. So simply when we talk about forecasting in healthcare, we could summarize it by saying it's just us or people in healthcare organizations predicting future trends, demands, outcomes that are related to various healthcare delivery activities. Now, we could also be asking ourselves, so what is it that we are forecasting? Remember, we have just said that the delivery with that the healthcare managers intend to do is surrounded by a limited future knowledge, or simply what we call uncertainty. So some of the things that we would be forecasting include patient volumes, disease prevalence. We could also be forecasting on that. We could also do financial forecasting. And generally, we could also be able to say that forecasting is a very, very important aspect in healthcare. That is to mean that once we do proper forecasting of what I've just mentioned as few examples, for this prevalence financial forecasting, number one, it's going to help healthcare organizations optimize staff. and medical supplies. When you talk about staff levels and medical supplies in terms of optimization, then we simply mean we can maximally take advantage of uh, better improved staff levels, um, medical supplies. We can take advantage of that and ensure that our patients are receiving the best of service that they could. Forecasting also is very important because it's going to help us streamline operations by where we anticipate the peak seasons. Maybe we have a disease that has become very prevalent, and therefore once we have done forecast, then we know that the numbers may not be going down, but they could be going up because of one reason or another. And then it helps anticipate patient needs. So you're looking ahead, you can anticipate what patients are going to need in terms of medication, in terms of treatment. And finally, through forecasting, healthcare managers and healthcare organizations are able to develop long-term strategic plans that are going to assist them to be able to make the appropriate decisions, even as the future remains uncertain. Now, when we also going to be talking about elements of forecasting, um, when you talk about elements, we are simply asking ourselves, what does forecasting involve or entail? When we talk about uh, forecasting entailing a number of things, number one, forecasting is going to entail, we are saying we do not have any perfect forecast. And even as we are forecasting, actual results are going to differ. The results that we anticipate in the next 5-10 years are going to be different, even though we had forecast. So that is something that we need to know in terms of about issues around forecasting. We also need to understand as element number two, forecasting is also going to involve a combination of experience. So sometimes we will forecast looking at previous months, previous years, what has happened, and previous judgments that we have been made, that we have made within a particular technical knowledge or technical area or a particular activity. We can be able to rely and focus on uh, past experience. We are also saying all forecasts assume past trends. So we look back, they acknowledge randomness. So even as we are forecasting, random things can emerge. And they are also, forecasts are also involved in terms of them having errors. Because we are saying we cannot be 100% correct. We could be forecasting, for example, the patient volume, but they are just statistical information that we are giving. They may not be 100% accurate. And we also saying accuracy is going to be decreasing as the time horizon or the future period is covered. The more the days are increasing, accuracy also is affected. And finally, when you talk about forecasting elements, flexible organization use shorter and more accurate forecast. So rather than forecast for 20 years where things are likely to change, then we could do short-term forecasts. And most organizations work with a few months because that is easier to predict rather than forecast using very many months or very many years, and then you are unable to get it right because the accuracy, the more we extend the duration that we are forecasting, the more it becomes difficult for you to get it right. When we are doing forecasting, there are a number of steps that we need to follow. And these steps are very, very crucial in terms of us getting our forecasting activities right. Number one, we need to define the purpose and identify the resources available for the forecast. So, what is the reason or the purpose of forecasting? Remember, I've just given examples of healthcare organization forecasting, disease prevalence, financial forecasting. So that would be an example of a purpose. Then excuse me, we go ahead in step number 2 and determine the period of forecast. So how long is the forecast going to cover? That's a critical question. Remember, when we are doing planning, of course, we focus on short term and long term. But when it comes to issues around forecasting, then my emphasis is to be able to do short term forecasting. It has a high level of accuracy in getting it to do long term in terms of very many years. So determine the period, and then the third one, we choose a suitable forecasting method. We are going to be looking at them, and when we are choosing a suitable forecasting method, we are also being guided by the resources available. Each method, of course, will come with its needs in terms of personnel, in terms of people that understand how to use that particular method. So, do we have that? Data, problem complexity, and so on and so forth. And then, of course, the other stage, number 4, we make sure that the data that we are using is very, very appropriate, and we make informed assumptions and analyze data variabilities. Variabilities are the changes that might be happening around our data. For example, if we are looking at the past, we want to analyze the patient volume, and we are seeing for the past few years, we are seeing quite huge fluctuations in terms of decrease in numbers. So why is that variability? As we go into the future, we can be able to ask ourselves that. And finally, we track forecast accuracy and be ready to switch various techniques if needed. So those are very, very critical steps that we can be able to use when we are doing forecasting. We have a number of approaches that we are going to be involved in when we are doing forecasting. We have the judgmental forecast, we have the time series approach, we have the causal model approach. These are the models that we will be discussing here. For example, when we use the judgmental forecast, we are simply relying on subjective opinions and nothing statistical when we are doing judgmental. Under this method, we have what we call the Delphi method. We have a jury of executive opinions, naive extrapolation, some of which are explained even in our next subsequent slides. So an example of a judgmental forecast that we can generally talk about, for example, we could have infectious disease specialists providing judgmental forecast about the potential spread of new infections. And when, of course, they are basing it on knowledge, on their knowledge, and also they are basing it on looking at similar outbreaks of an infectious disease that maybe have been able to happen. So that's why we are saying they are just subjective opinions. We can use that. We can use subjective opinions to look ahead and see what is the likelihood of these forecasts happening. We have a clarification of these particular methods here now. The first one is the Delphi method. We are saying that this is an iterative process that is meant to gather expert opinions through a multiple round of questionnaires. So key to note when we are using the Delphi method, there is also the introduction of questionnaires, and then also allowing for anonymous feedback, because questionnaires, if we want to get also very critical information, we may not necessarily need to know your names in the questionnaires. That's why we are saying they allow different kinds. Number one, it's going to depend with the nature of information that we are seeking. Again, we should not make it very lengthy because of this challenge of people not filling the entire of the information that has been provided. Some of the strengths of using the Delphi method: number one, it facilitates anonymity. That's what we are talking about. We may get very good information that can help us to forecast, but we don't 100% know who gave the information. We just know this participant or this person who answered this questionnaire was among a group of people. Yeah. So the other one is interactive feedback that allows experts to learn from each other and refine their predictions. Yeah, so this feedback that we continue to receive here, if we have it maybe in hundreds or in 500s or in thousands, then experts can be able to sit down and look at the information provided and be able to refine certain predictions in terms of our forecast. And then also it can be cost effective and relatively quick to implement. So this one, you just need to have a number of people. You put a request to them that there is a questionnaire that you'd like them to fill, and they are able to respond. They are able to give you feedback based on the questions that you have asked. Some of the weaknesses of this method is that it requires a careful design and facilitation to avoid ambiguous questions. So how do we design our questionnaire? That's a very important issue under the Delphi method. And if we are not keen on it, then we could have excessive information, some of which we do not need. We could have information that is ambiguous. And so we could also have a challenge of bias interpretations. People are going to interpret these questionnaires based on their leniency on a particular side of whatever questions that are being asked, and not ideally on what is happening on the ground. And also, consensus might not always reflect the most accurate individual judgments. We could be having so many people giving their comment on a particular issue X, and that should not be what makes us conclude it's good or bad for a healthcare facility. And also, all of you know that questionnaires can also be very, very time consuming. And if we are doing it for a series of rounds, it ends up wasting a lot of our very precious time. Then we have what we call the jury of executive opinion. Remember, these methods mentioned previously here. We want to clarify them a bit. Now, when you talk about the jury of executive opinion, we are relying on collective wisdom from a small group of internal experts. So when the Delphi method is relying on questionnaires that are distributed to a number of people, the jury of executive, we rely on internal experts, and we can pick these experts from different departments in the healthcare organization to be able to give their comment on maybe like what I said in terms of infectious diseases. Part of the strengths and the benefits of the jury of executive opinion, they leverage diverse expertise and perspectives within the organization. When you talk about leveraging, we are talking about taking advantage of various experts within the organization. And then also it's going to facilitate discussion and debate. So because we are bringing people together who are experts within the organization, the people that we are calling internal experts, we could have an opportunity for them to give a comment or two, leading to a robust conclusion. And then it is quicker and less expensive than the Delphi method. So this one is a bit fast. Remember, Delphi method, you have to really take time to give the participants to respond. So you cannot just sit people down and you are telling them in 2 minutes fill up the questionnaires. Probably you are going to receive past information that has been hurriedly done, and therefore it is going to affect your forecast. And then also some of the weaknesses of the jury of executive opinion is that it's prone to groupthink and biasness due to close interaction and potential power dynamics, because we are picking these people from the internal point of an organization. There is the element of even people trying to outdo each other in terms of who is a more expert than the other. And then also what we have limited diversity of viewpoints compared to the Delphi method. And finally, it requires a very careful selection of participants. So sometimes if we do not select our internal team very well, then the expertise that is going to be given there will not be very biased. We have this method also that was in the list that is called naive extrapolation. Another name that we can give to this method is naive forecasting. And when we are using this kind of a method, we assume future values will be the same as the most recent value. Yeah. So when we are using this naive extrapolation method, we are looking at the future, but we are looking at the future, forecasting at the future by looking at a consistent previous pattern. For example, we could be looking at an healthcare facility. We want to be able to understand the levels of admission in the facility in terms of number of patients. Let's take, for example, we have January, we had 100 admissions. February, we had 110. March, we had 120. April, we had 115. May, we had 125. June, we had 130. When we are using the naive method, or what we are calling naive extrapolation method, we are simply saying if we want to determine what will be the likely number for admissions in July, because January to June they are revolving around 100, 110, 120, 115. So most likely we could do 130, we could do 135 for the month of July. So we are looking at the trend from January to June to be able to determine the next month the number of admissions that we are likely to have. That's what we can be able to apply the naive extrapolation method. And part of this, the strength of this method is that it is extremely easy and cost effective to implement. You are not incurring quite as any cost. You just need to go back to your records. And nowadays we have technology. Patient record is now being able to be stored in a better way. And therefore may be accurate for short-term forecast in stable situations. So if we want to do short-term forecast, like now we are only focusing for the month of July. We don't need so many questionnaires to find out, like in the Delphi method. Just look back the number of months and then be able to determine. You can see the changes or there is increase in 10 patients, 5 patients. So we could work with an amount around that. So when you are using these methods, it is very easy to determine in terms of medical supplies, how much do we need? In terms of personnel, how many do we need? And so on and so forth. We can use this particular method. Some of the weaknesses is that it ignores potential changes and trends. So we are just looking at the ones here. We may not really be 100% sure that ideally it's going to change by 5 or 10. Highly inaccurate for longer term predictions. So we cannot be reading January to June to use that information to give us 10 years to come. Definitely things are going to have changed. So the naive method or the naive extrapolation method is very good in terms of short term, but for long term, it may not be the best. And finally, it provides little insight into underlying factors influencing the future demand. Now, we have what we call the time series approach. And when we are talking about the time series approach, we use historical data to predict future values. And we identify various kinds of trends. We identify different seasons or seasonality. We identify cycles and random variations that could be happening around our healthcare facilities. When we are using the time series approach, other methods that we use are moving averages, exponential smoothing. We can use that method also, ARIMA models. All these are classified or elaborated in our next few slides. Now, when we talk about the moving average, this kind of an average data points, they have they take average data points of a specific period. We could be looking at an average information of about particular data, for example, weekly, for example, monthly, and reveal under the moving average, for example, we have what we call the simple moving average. So in this kind of method, we use average data of the last few data points. And an example is when we are using the simple moving average, we could be calculating average of a specified number of data points of a period of time. We could use this, for example, in an hospital that intends to focus on an average daily patient census. We want to look at an average, we want to undertake a census of the average patients that visit our facility every day. I have a friend who works in a particular organization where they have a system that every evening can tell them how many people they have served. So I usually ask them when the day was very busy, how many people did you serve? 2,000, 3,000. It's a government institution. When you are using the simple average method, then, for example, we could take this health institution and we want to take an average of the last 8 days. How it's been in terms of the patients. So day one, let's take for example, we served 25 patients. Day 2, we served 28 patients. Day 3, we served 30 patients. Day 4, we could have served 32. We could have served 29. We could have served 31. Day 7, 33. Day 8, 35. So we watched the average of the last 7 days. So when we are talking about the simple average, then we are going to pick from day 1. Since we started receiving the 25 patients to day 7. So we add all that. We add from day 1 to day 7. So 25, 28, 30, we add all that. And then because we are looking at the simple average for 7 days, we can divide that by 7 maybe and get a figure around 29 point something. So that's why we are calling it simple average. If we are looking for an average of 8 days, then we count from day 1 to day 8. Then we can add all those number of patients that visited us around that time. Then we divide it by 8 to get an average amount of number of patients. I'm sure you have had those conversations in healthcare facilities. So under moving averages, you can also do research around what we call weighted moving average, also exponential moving average, and be able to give examples like I've been able to give for the simple moving average. Part of the strength of this kind of it is easy to understand. I think it's when you're saying it is easy to understand, it's simply an addition and division kind of a scenario that we are using the simple averages. We are calculating averages just like we have calculated the simple average for the healthcare facility that we were looking at as an example. And it's also very effective in terms of covering short-term trends. And it is flexible and adaptable to different time horizons. So it can be used anywhere to be able to achieve a goal. Maybe we want to achieve a goal, like what I talked about the patient sensor. Some of the weaknesses is that it is less effective for forecasting long-term trends and customer and complex patterns. Some of these methods, you can see they work very best when we are utilizing them on a short-term basis. And also choosing the right window size and averaging method could be very challenging. So sometimes it could be difficult. We can assume maybe we want to work more days. We want to get and then we are not talking about the 25s that I'm talking about. We are talking about huge numbers. We have healthcare facilities that, like I've given that example, they serve so many people within a day. And then also this particular method, it may not really account for seasonality or other cyclical variations. We may not be able to say season X was having more figures or more numbers than another season, because ideally in these moving averages we are focusing on the average amount. Yeah, so those are some of the weaknesses. Then we have what we call exponential smoothing, saying this method is going to build upon the idea of moving averages. So it builds around the same idea. But the key focus is it assigning decaying weights to past data points. So we are looking at past data points, and then also we give more emphasis to recent observation. So we are doing some form of comparison from our data point to comparing that with the recent information that we are. We could be looking at the patient sensor maybe for 2-3 years back, and we want to use exponential smoothing. So we also bring in the recent observations. So we are going to have variants, what we call variations in this kind of method. What we call the simple exponential smoothing. For this, we are going to use a single parameter to weight past data points. So our single parameter could be the number of patients that we will be serving. Our single parameter could be, now because we have served so many, a single parameter could be us focusing on patients maybe who are suffering from a specific disease. Could it be diabetes, and so on and so forth. Other variants will come upon when we what we call Holt's linear trend exponential smoothing. So we account for events. And finally, when we talk about Holt-Winters exponential smoothing, we are going to incorporate seasonality into the forecast. So if we are looking at a particular season, for example, we had a season around COVID that was very tough, and then let us assume COVID has arose again. Then we can now look at our previous season of and be able to assist us to forecast what is the likelihood of us finding ourselves in a very fixed position, maybe in terms of lack of enough beds and other issues. But we are looking at the previous season of what the disease or how the disease affected us. Part of the strengths, or what we could call advantages, is that it is a relatively easy to implement method. and interpret. You can very easily, if we are looking at seasons, we can very well be able to interpret that. And then it is also very less sensitive to choosing the right window size compared to moving averages. We can always be able to choose very easy if it's a season like the one that I've just given for COVID-19. Part of the weaknesses of this particular method is it's going to rely on choosing appropriate smoothing parameters. Sometimes these parameters are challenging. If the facility, for example, did not keep their data very well, so it means we are not going to get enough information as we would want. And it's not ideal for highly complex data with sudden changes. So we intend to use data that is very easy to get. But again, we need to have the right record when we are using this particular method. Otherwise, we could want to retrieve information for patient issues around matters COVID, but we don't get the correct information because we do not have the correct data. Then we have what we call the ARIMA method. It's an abbreviation for what we integrated moving average. And we are saying this kind of a model is going to capture past values, and these are going to be able to influence the future and integrated. And we need difference to be able to achieve a certain behavior by using the method that we have also called the time series method. And what we are calling the ARIMA method also is very useful when we are analyzing and forecasting data that exhibits complex patterns. We could be having information of data that is, in terms of deviation, it's very high. Today we are recording 2,000 patients. And remember, for example, we could be talking about patients around HIV issues. And you know, if you do not get your numbers right, then you could find yourself in trouble. Maybe have less medication for these people, and so on and so on. So we need information that is not complex. If there are specific numbers and we have that record, we can be able to retrieve them. When we are using the ARIMA method, then we use letters like P to indicate the autoregressive terms. Letter D, it's going to show us the differencing orders, and letter Q is going to be enabling us to understand the moving average terms, the moving average that we have just mentioned. So letter P, what we are calling autoregressive terms, we are saying it is a parameter that represents a number of past values of the time series that are included in the model to predict the next value. So the letter P, what you are calling autoregressive terms, is going to give us some values of the past, and we are giving an example here. An of 200 model would consider two more significant present values to be able to predict the next one. So higher values of P can capture more complex patterns in the data, and it will also increase the model's complexity and risk of overfitting. So it's also a very interesting model. You have to work around it by understanding these terms, the autoregressive terms, to make it very easy for you. When we are talking about differencing order, we think that this parameter is going to the number of the time series that can be to achieve stationarity. We're talking about stationarity here. It means statistical properties series and mean variance that are going to remain constant over time. And this method is going to involve subtract the values from the current values, essentially removing trends and seasons. So if we are looking at previous values of infectious disease patients, how many were they? The current number. and then we can be able to take maybe we're looking at the numbers increasing or decreasing. That can be able to tell us about the difference in order. And then moving average terms, we are saying this parameter is going to represent the number of work. The difference between predicted and actual values. Remember, we said when we were starting, sometimes what you predict and what happens when the future is here with us may not be the real figure to predict it. Now, the moving average terms are going to be looking at the what did we predict? We were looking at the past, for example, 2000, and then we know in the next 2-3 months how many could be meeting, and then we could give a figure that may not be very accurate because of course we are forecasting. So we're saying this particular method will essentially smoothen or it smooths out errors and reduces the impact of the forecast. So is having a number of ways to approach forecasting. Then we have the ARIMA notation. These parameters are combined into the ARIMA PDQ that we have just mentioned. So the integers, we have indicated what they represent. Remember we saw that ARIMA method that we were talking about 200, so we could have 110. It's going to be using the first value of P as 1. And then differentiating step where we talk about D. The other one could be D, and the normal average could be the 0. So these values that are put in bracket then represent what we have indicated here as the PDQ that we have discussed previously there. Some of the advantages of these methods or the ARIMA model, it is highly flexible and adaptable to a wide range of data patterns. So flexibility means we can interchangeably and in different ways be able to use this particular method. And then it will be able to account for trends. So if we're looking at increasing trends, decreasing trends, seasonality, this particular method could be of great help. And then also it is often going to provide more accurate forecasts and simpler methods. So this method will be more accurate. Part of the weaknesses is that it requires more advanced statistical knowledge. Yes. And, to some extent, we now use softwares to be able to input and interpret information and model. And then also selection of appropriate ARIMA model and parameters can be very complex. And finally, be computationally expensive for large data sets. Using figures, sometimes it becomes very difficult to work for our favor when we are using this method. Then we have what we call the causal models. We are saying that this relates to future values, other variables that influence them. When you are using the causal model, for example, we are talking about things like regression analysis. We are talking about econometric models, and we are also talking about simulation models. These models are discussed here. For example, regression analysis. We are saying this statistical technique we are calling regression analysis is going to identify various relationships between variables, and then we use them to predict future values of a dependent variable. This, of course, is going to be based on independent variables. We can, for example, use this to do patient prediction, readmission risks. We could base this on demographics. When you talk about demographics, is in terms of population in an area. We could use also this or other methods that we can be able to use are we call the simulation methods or simulation models. And we are using these models, saying that they are computer-based models. And these models, they are going to replicate real-world systems by simulating the behavior of individuals. The places where we use models are when we want to check the impact of different patient flow. So we are looking at the patient flow and how we can manage that. We are using that to predict the effect of new healthcare interventions. Probably we had an outbreak of a disease and we came in and did some intervention. We can use that to be able to assist us to see whether the intervention is working. Some of the strengths, and I also encourage you to look more into these, the strengths and also the weaknesses. You can be able to read that on the simulation models. Like when you're talking about it being data intensive, and we require significant expertise in model building techniques, and also results in heavily dependent on accuracy and completeness of the underlying model and assumptions. And also we have a weakness in terms of our ability to interpret whatever simulation that has been able to do for us. And finally, how do we choose the best approach? It is going to depend on several factors. All the approaches that we have talked about. Number one, it is going to depend on accuracy requirement. What do we require in terms of accuracy? How is it important to have an accurate forecast? Of course, nobody wants to be making forecasts that are very inaccurate. And then also we need data availability. That's why I was mentioning. Then if we are using most of these models, then the question is, do we have historical data that is available? If we do not have, then that means forecasting is going to be a problem. Time horizon, how far into the future are you trying to predict? You've seen most of them are emphasizing on a short-term prediction. And finally, the complexity of the problem, where we want to find out how many factors influence the variables that are being predicted. So when we are choosing the right approach, this is very important for us. So it has to adhere to the following issues that we have highlighted here. So do more research on the methods, and also you can also find out whether we have other considerations when we are choosing the right approach. So that is going to bring us to the end of discussion today. I was it's longer than it was some when we were starting. I don't know when I have a comment to make.
Yes, thank you so much for the presentation. In fact, I appreciate it because when you look back into our WhatsApp group, even I've been asking because most of my models have not been lectured, and I was asking. Otherwise, I appreciate all this because we had been in the practice and forecasting. For us, we had been doing something that we even don't know, but at least with
Yes,
this presentation, we are able to know what we are doing, especially when we are using the population of the previous the expenses. Like in the
yes,
medical field, how many paracetamol we have used in the previous month, and then you need to
yes.
add on what you will have this month, and then we know of putting out the buffer. So we didn't know that we are doing the forecasting, but at least by this we are able to understand and get it better. Thank you so much.
Okay, you're welcome and have a good night.
Good night too. Good night.